That is the end of part A. Now look at part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B or C which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. You hear part of a conversation between a doctor talking to a patient. Now read the question.
Good morning, how can I assist you today?
Hi, I've been experiencing a lot of pain and rash on one side of my body. I went to see another doctor and was told that I might have shingles.
Okay, I'll take a look. Can you describe your symptoms in more detail?
Yes, I have a painful rash on my torso and it's only on one side. I've also been feeling very fatigued.
Based on your symptoms, it does sound like you have shingles. I'm going to prescribe you some antiviral medication to help reduce the severity of your symptoms.
Thank you. Is there anything else I can do to relieve the pain?
Now look at question 26. You will hear a part of a speech given by a healthcare professional. Now read the question.
Assistive technology can also be used to improve communication and social participation. Communication devices, such as speech-generating devices and picture communication systems, can help individuals with communication challenges to express themselves and engage with others. Social robots and virtual reality systems can also be used to promote social interaction and engagement. Lastly, assistive technology can also be used to improve cognitive function and mental health. Cognitive aids, such as memory aids and reminder systems, can help individuals with cognitive challenges to stay organized and remember important information. Sensory aids, such as weighted blankets and sensory toys, can also be used to promote relaxation and reduce anxiety. In conclusion, assistive technology is a critical aspect of occupational therapy, and its applications are vast and varied. By promoting independence, improving mobility and accessibility, enhancing communication and social participation, and promoting cognitive function and mental health, assistive technology devices can significantly improve an individual's overall quality of life. Thank you for your time, and I hope this talk has given you a better understanding of the science of assistive technology and its applications in occupational therapy.
Now look at question 27. You hear part of a conversation between a nurse and a patient. Now read the question.
It's important to find an activity that you enjoy and that fits into your schedule. This can be anything from walking to swimming to dancing. Aim for at least 150 minutes of moderate intensity exercise or 75 minutes of vigorous intensity exercise per week. You can also incorporate strength training exercises to build muscle mass, which can help with weight loss and overall health.
That sounds doable. What about portion sizes? I know I tend to overeat.
Yes, portion control is important. A nutritionist can help you with this, but some general tips include using smaller plates, measuring out servings, and being mindful of portion sizes when eating out. It's also helpful to slow down and savor your food, which can help you feel more satisfied and avoid overeating.
Okay, I'll keep that in mind. What about support? I'm worried that I'll lose motivation and give up.
It's important to have a support system in place. This can be friends, family, or a support group for people with similar goals. Your nutritionist and personal trainer can also provide support and accountability. It's normal to have setbacks, but it's important to keep going and stay committed to your goals.
Thank you. I feel more confident about making these changes now. I'll follow up with you after I've met with the nutritionist and personal trainer.
Great, I look forward to hearing about your progress. Remember, making small, sustainable changes over time is the key to success. Good luck.
Now look at question 29. You will hear a part of a speech given by a healthcare professional. Now read the question.
One of the primary benefits of articulation therapy is improved communication abilities. When an individual has difficulty producing certain speech sounds, it can make it challenging for others to understand them. This can lead to frustration and social isolation, particularly in children. By improving their ability to produce speech sounds correctly, individuals can communicate more effectively, which can lead to better relationships, increased academic success, and overall improved quality of life. Another benefit of articulation therapy is increased self-confidence. When individuals have difficulty producing certain sounds, they may feel self-conscious or embarrassed when speaking. This can impact their confidence levels and their willingness to communicate with others. By improving their ability to produce speech sounds correctly, individuals can feel more confident in their communication abilities and may be more likely to engage in social interactions. Finally, articulation therapy can improve social skills. When individuals have difficulty producing certain speech sounds, it can make it difficult for them to interact with others. This can impact their ability to form relationships, make friends, and participate in social activities. By improving their ability to produce speech sounds correctly, individuals can improve their social skills and overall quality of life. In conclusion, articulation therapy is a critical component of speech therapy that can benefit individuals of all ages who struggle with producing certain speech sounds. By improving communication abilities, increasing self-confidence, and improving social skills, articulation therapy can have a positive impact on individuals' overall quality of life. Thank you for listening, and I hope this talk has been informative and helpful.
Now look at question 29. You hear part of a conversation between a GP and a patient. Now read the question.
Are there any side effects to the treatment options?
Some medications can have side effects, but we will monitor you closely to ensure that any side effects are managed effectively. It's important to follow the treatment plan closely to improve your quality of life and prevent complications.
Thank you. I'm willing to do whatever it takes to manage my symptoms and improve my health.
That's great to hear, Miss Lee. It's important to take a proactive approach when it comes to managing your health. Osteoporosis is a chronic condition, and there's no cure for it. However, with the right treatment and lifestyle changes, we can slow down the progression of the disease and improve your bone health.
That makes sense. What lifestyle changes do you recommend?
Lifestyle changes include adopting a healthy diet that is rich in calcium and vitamin D, regular exercise, and quitting smoking. Calcium and vitamin D are essential for building and maintaining healthy bones. Exercise helps to increase bone strength and density, and quitting smoking can reduce the risk of fractures and other complications.
What kind of exercises are best for osteoporosis?
Now look at question 30. You hear a part of a conversation between a healthcare professional and a client. Now read the question.
Good afternoon. How can I assist you today?
Hi, I think my dog has allergies. He's been scratching and licking a lot lately.
Allergies are a common issue among pets, particularly dogs. What type of symptoms are you noticing?
He's been scratching a lot and his skin is flaky and red in some areas.
That's a classic sign of allergies. We need to determine what's causing the allergy to address it effectively.
Okay, how do we test for allergies?
There are different testing methods available, but one of the common ways is skin testing, where we shave a portion of the fur and apply a specific allergen to monitor the dog's reaction. Another option is blood testing that checks the dog's blood for the presence of antibodies that identify certain allergens.
How do we manage allergies once we know what's causing it?
The treatment plan depends on the severity of the symptoms and how frequently they occur. Some cases require medication, while others can be managed through dietary adjustments, changes in environment, or allergy shots.
I see. Is there anything I can do preventatively to reduce my dog's risk for allergies?
Unfortunately, in some cases, allergies are genetic and, for others, there's no definitive prevention method. However, there are steps you can take to reduce the severity of the symptoms or prevent them from happening. For instance, regular grooming can help reduce the exposure of allergens on your dog's fur. Air purifiers can be helpful, and ensuring your pet is eating a balanced diet is important.
Thank you so much for your help. This has been very informative.
You're welcome. Let's book a follow-up appointment once we have test results to manage your dog's allergies.
That is the end of part B. Now look at part C.